A full body mobility sequence, floor-based. Precautions. If at any time you feel discomfort during any of these stretches, back off a little bit and try again a little bit slower. If it's too uncomfortable, skip it and return to it at another time. It's not unusual for these stretches to elicit a little bit of discomfort, but they shouldn't elicit pain. To begin, we're going to stretch the posterior chain, using the simple tennis ball and working at our feet. Gently massage your foot back and forth for up to a minute. The posterior chain is a band of muscles that start from the feet and ascend all the way up to the neck, along with all of its connective tissue called the fascia. Allowing these tissues to have good flexibility and motion up and down the spine is essential for good spinal health. I recommend 1 minute of the tennis ball massage, and then you drop the heel and stretch the neck for another minute. Then you switch feet for 1 minute on the tennis ball massage and 1 minute with the heel neck stretch combination. Here I'm showing the same sequence but from a different angle. Begin by bringing your right knee as far to your chest as you can and holding it for 30 seconds. After 30 seconds, gently press your knee into your hand for 5 seconds, relax for 5 seconds, and then repeat that 3 times. And then with your left leg, push your heel into the floor for 5 seconds, rest for 5 seconds, repeat 3 times. Then bring your left knee to your chest and repeat the cycle. Bring your knee to your chest, hold that for 30 seconds, and then 5 seconds press into your hands, rest for 5 seconds, repeat that 3 times, and pressing your right heel into the floor for 5 seconds 3 times, resting 5 seconds in between. Next, we proceed to lumbar mobility and quadratus lumborum stretch. There are several ways to do this stretch. I'm going to show you 3 different methods. The first method would be pulling your bent right knee with your left hand. Slightly more advanced is taking the left leg and bending it over the right knee and twisting to the left, letting your arms relax to the side as shown. Next would be bringing the right foot across the body and reaching the foot as far as possible, while at the same time trying to keep your arms, particularly the right arm in this picture, on the floor. Now I'm going to demonstrate it again, but on the opposite direction. For this stretch, you can place the foot of the bent leg on either side of the knee. For all 3 of these stretches, you can hold them for 30 seconds to up to 2 minutes, or 5 to 10 breaths. Next, we proceed to do lumbar flattening, as described in my lumbar flattening instructional video. I recommend trying to do at least 10 lumbar flattening motions, as shown here, moving your hips up and then down, posterior, anterior. Next, we proceed to do diaphragm stretching, gently taking our fingers and placing them under the ribs, pressing gently upwards. You may feel a little bit of discomfort, but it should not be painful. I recommend doing 10 deep breaths into your fingers. Now proceed to do a thoracic mobility exercise, as demonstrated in my thoracic mobility instructional video. If I'm doing this entire mobility sequence as my exercise of the day, I'll do the thoracic mobility for up to 3 minutes. But if you don't have that time, consider doing it for at least 1 minute. We now proceed to doing thoracic mobility in the prone position. Next, we proceed to doing the prone thoracic mobility exercise, commonly known as the child's pose. You can hold this position for 2 to 3 minutes, or you can also lift your hips up gently and back down, trying to get your heels to get close to your buttocks. Here I'm demonstrating the child's pose using a foam roller and how I can rock back and forth. If time does not allow for you to do this for 3 minutes, at least consider doing it for a full minute, or 3 deep, long breaths. Next, we proceed to do some core strengthening through some pelvic bridges, as described in my Core 4 fitness video. You can increase the challenge by trying to get your hips as high as possible, as well as lifting your arms off the floor and eventually behind your head. And then concluding with keeping one foot off the floor while keeping your hips as high as possible. Just do the best you can. If all you can do is pelvic tilts with your hands on the floor, then try 10 of them. No matter how you do it, are you able to do a pelvic bridge and hold it as high as you can for 1 minute? Next, we proceed to do a fairly complicated stretch that works on the posterior chain of the spine. This includes the muscles as well as the connective tissue or the fascia that goes up and down the spine and actually connects to our feet. Now lift the foot that corresponds to the hand that's above your head and try to lift the foot up and over the other foot. In this case, it's the right foot and the right low extremity reaching over and trying to touch the floor on the left side of the body. Maybe all you can do is lift up the right foot and just barely get it over the left foot. If that's all you can do, that's fine. Just keep lifting the right foot up a little bit over the left foot, then back down. Can you do it 10 times? As your spinal mobility and overall spinal health improve, you'll be able to rotate more and finally get the foot to the opposite side of your body. As you're able to get more rotation, consider just holding that position for 30 to 60 seconds. This stretch also works the deep spinal muscles, which are critical for core stability and overall spinal health. Just remember, whatever arm is over your head, that's the leg to lift and twist to the other side. We finish this sequence with the spinal extension stretch that is often called the cobra. The next exercise is called prone extension, also known as the cobra, which means that the front of your hips are as close to the ground as possible as your spine leans backwards. Also, you do not have to fully extend your elbows, just get them about 3/4 extension. Here I'm adding some simple rotation to the left and to the right. Try to do the prone extension for about 2 minutes. Now proceed to do the half kneeling position with the rear foot slightly outward, the front foot directly below the knee, your back straight, and slightly glide forward. Do not arch your back, but keep your back straight and only glide forward. This is the best way to stretch the iliopsoas muscle, which is known as the hip flexor muscle. Next, I'm going to point to my butt muscle, called the gluteus maximus muscle, and after about 10 seconds of the gentle glide forward, I'm going to squeeze my butt muscle to give it some strength training. Now here I'm bringing my right arm overhead, which is opposite of my rear foot, and I put a little stretch into my elbow. This stretches the right quadratus lumborum and latissimus dorsi muscle, two really important muscles of the back. Next, we proceed to stretch the front thigh muscle called the quadricep. This does require some balance, and you might want to put a cushion underneath your knee to make it more comfortable. Now we're going to switch and show it to you from the other side. Right foot back with the right heel slightly outward. Slight glide in my hips while I keep my back straight. Consider this sequence 1 of this routine. Then sequence 2 would be squeezing the buttocks muscle called the gluteus maximus as you're slowly gliding forward and backwards. The gluteus maximus muscle is the opposite muscle of the hip flexor muscle. The gluteus muscles are opposite of the hip flexor muscles. The combined efforts of hip glide with butt squeeze helps to improve and maintain hip muscle balance. Sequence 3 would be the latissimus dorsi quadratus lumborum stretch. The fourth and final sequence will be the thigh stretch of the quadricep muscle. Do each sequence for 30 seconds or one full breath. So this entire kneeling sequence should take at least 4 minutes to complete. These stretches might elicit a little bit of discomfort, but they shouldn't cause pain. Do not force the movement, but gradually try to work into that movement over a course of days or weeks.